Hello and welcome to the Cannabis Clinic podcast, where we discuss medicinal cannabis and how it can help you improve your life. This is Dr Waseem Alzaher, and I'm a doctor working at the Cannabis Clinic, and welcome to our first ever episode. In these episodes, we're going to cover a range of topics and also invite you to ask any questions you'd like to get answered to help you hopefully live a better life. So, as you know, medicinal cannabis can help a wide range of conditions, and in New Zealand it's been a legal prescription medicine since late 2017. There were some restrictions at that time, however since April of 2020 medicinal cannabis has been unrestricted, and which means that us doctors have been able to prescribe it to any people that we think it might help. So that's great. So in this podcast what I'm going to do is cover a few basic questions about CBD oil, medicinal cannabis in New Zealand, and invite you to ask any questions or feedback. A little bit more about me. So I'm a GP and I work in New Zealand, and I've been a doctor for the last 8 years. I started off working in the community. However, after seeing so many people and treating so many conditions, it became quite apparent to me that the use of pharmaceutical drugs, although it can be very helpful in many conditions and situations, is also very limited. We use a lot of medicines to treat problems, and then we create more problems as side effects from those medicines. Plus, they're all artificial and non-plant-based, which is not something that gives me a lot of confidence when prescribing. I'd like to incorporate more of plant-based medicine alongside using normal pharmaceutical medicines. And hence why we started the Cannabis Clinic back in 2018. Since that time, we've helped thousands of Kiwis throughout New Zealand use medicinal cannabis, and we've treated a wide range of conditions such as chronic pain, anxiety, PTSD, other mental health concerns, and a lot of people with sleeping problems or insomnia. Since that time, I've also had the opportunity to learn a lot more about medicinal cannabis myself, how to use products correctly, how to dose things correctly, how to avoid side effects, and how to tailor the treatment plan in the best way possible to suit the person that I'm treating. Medicinal cannabis, I think, is a really good option if you've had a health condition that hasn't responded to conventional treatments, and I really encourage you to discuss this with your doctor. If you can't get in to see your doctor, please let us know, and we'll be more than happy to help talk you through that. So what I'd like to do today is just jump straight in and cover a few basics about medicinal cannabis in New Zealand, and like I said, invite you for any questions. So to start off with, I'd like to talk about CBD or Cannabidiol. Now you might have heard of CBD oil mentioned here and there, but the question is, what is CBD? And so CBD stands for Cannabidiol, and this is an extract of the cannabis plant. It is only one of the extracts of the cannabis plant, and there are many other compounds as well. The other main compound in cannabis is THC. THC is responsible for the high that people experience when they use cannabis recreationally, whereas CBD does not cause that at all. Both CBD and THC are very important when we use it medicinally, because certain conditions seem to respond to one type of compound, whereas other medical conditions seem to respond to other. And for some, they respond to a bit of both. Now, a lot of people have a lot of doubts and hesitation about using CBD and THC because they think it's going to make them high, or they're going to be addicted to it, or they're going to be cannabis users. But all these are not true, because there's a vast difference between using cannabis medicinally versus recreationally. When people smoke cannabis, they're taking in a huge amount of THC and a huge dose of it, and it goes straight from their lungs into their blood, and you very quickly overshoot what you require to get a benefit, and you start having the side effects or feeling high from it. Whereas we use oral products in controlled and low doses to make sure that we get the benefit, but hopefully without any of the side effects. So that's CBD for you. Now, in New Zealand, there's a range of CBD products available, and they come in a variety of concentrations and sizes. And overall, most CBD products are relatively similar to each other. There's not a huge amount of difference between them. Whereas for THC, again, there are a range of products available, but we're a lot more limited in terms of what we can offer in New Zealand at the moment. But again, it's mostly to do with the concentration and the strength of it. Now, you might be wondering whether CBD oil or THC can be purchased over the counter, whether it's legal in other forms. And the answer is no. CBD oil and THC products, or medicinal cannabis in general, is a prescription-only product, which means that your GP or specialist must prescribe it to you, and obtaining it in other ways, such as from green fairies or other suppliers, is not currently legal at the moment. Now, what are the benefits of using CBD oil? Well, CBD oil has lots of benefits to the body. There's evidence that shows that CBD oil can help reduce pain, inflammation, anxiety, can help promote deeper sleep, and also can promote a sense of general well-being. CBD oil is very safe and it's well tolerated, which means that having side effects is quite rare, and if they do happen, they're usually mild. You may be wondering, what conditions can CBD oil and medicinal cannabis treat? Now, that's a very good question. There are a range of conditions that CBD oil and medicinal cannabis can treat. The most common issues we deal with are as follows. Pain and chronic pain. Now, this can be due to an injury or long-term pain, or sometimes the cause of the pain is not known. Or it can be associated with pain conditions such as fibromyalgia, where there's widespread pain. Pain is a common issue that we deal with when using medicinal cannabis, and it can also be very effective. Mental health issues come in at number 2. So pain is number 1. Mental health issues are number 2. Now, this includes things like anxiety, depression, PTSD, autism, and ADHD. A lot of people use CBD oil and medicinal cannabis for these conditions with good results. And the third biggest reason we use medicinal cannabis is to treat sleep disorders. And it's usually insomnia and having a difficulty getting a full night's rest or waking up during the night. We also use medicinal cannabis to treat inflammatory and gastrointestinal conditions. So these includes things like irritable bowel syndrome, Crohn's disease, ulcerative colitis, and other conditions where they are autoimmune conditions, or where the body's immune system is involved in attacking its own tissues. For example, this could be in psoriatic arthritis. We also treat a range of neurological conditions such as Parkinson's disease, tremors, multiple sclerosis, and also cancers and cancer treatment side effects. So, for example, we use a lot of THC to help promote appetite, to make your treatments, if you or a loved one are undergoing treatment for cancer, then THC can be quite effective in improving appetite and helping reduce nausea. So that, in a nutshell, is what we do at the clinic, and we run a medicinal cannabis clinic alongside a dispensary here, where we have all these products that people can be prescribed and that can buy from our clinic. You might be wondering if there are any side effects or risks with using medicinal cannabis and CBD oil. Overall, medicinal cannabis is very safe. Like I said before, CBD oil is extremely safe and well tolerated, meaning that we run into very few problems. As a matter of fact, it's very difficult to overdose on CBD oil, and unlike other things, for example, ibuprofen or paracetamol, where you could overdose with it a lot easier. THC is also very safe and well tolerated. However, we do use it with a little bit more caution because it is stronger and it is considered legally a controlled drug in New Zealand. but it is still also very safe. Reports say that there's low evidence to show that THC is addictive, especially when used orally, so we're quite comfortable to do that. And although it can cause side effects when taken in large doses, at the doses that we use medicinally and orally, we have run into very few issues, and they're usually to do with people taking the wrong dose or increasing their dose too quickly beyond what we've recommended. Another common question we get asked is if CBD oil is safe for children. And the answer is yes, it is. We have a lot of children in our clinic that we use CBD oil for. And as a matter of fact, the FDA in the US has approved a medicine which is a CBD-based medicine to use in children for various seizure or epilepsy conditions. But it's not just seizures. We use CBD oil in children for a number of conditions, mostly to do with anxiety, ADHD, and seizure conditions. A lot of people take many medicines and they ask us the question of, are there any medications that interact with CBD oil? There are a few medicines that could interact, but nothing that would stop you from being on medicinal cannabis. This includes medicines like warfarin, clobazam, and various anti-seizure medicines such as sodium valproate. It's best to talk to your doctor or to us to get specific advice around this. The other question we get asked a lot is hemp oil and CBD oil. What's the difference? Many people think that using hemp oil is the same as using CBD oil, but unfortunately it's not. Hemp oil is made from the seeds of hemp plants and contains almost no CBD or THC in it, and therefore can be sold as a nutritional supplement, whereas CBD oil is extracted from the flower of the cannabis plant and contains this active ingredient. CBD oil comes in many forms, and some people ask us, well, what is a full spectrum CBD oil? A full spectrum CBD oil is a whole plant extract of CBD, which means that it's not isolated CBD, but it contains other cannabis compounds with it that theoretically should make it a superior and more effective product. How much CBD should I use? We normally start people using 25 milligrams of CBD a day and quickly increase it up to 100 milligrams per day, spread over 3 or 4 doses to get the most benefit. What is the cost of CBD oil in New Zealand? The cost is probably the biggest factor when it comes to using CBD oil and medicinal cannabis. Usually CBD can cost you anywhere between $3 and $5 per day, and a medium-sized bottle will usually cost you between $150 to $200. That bottle would last around about a month or so, and it really depends on what dose you're using. Using THC, however, is actually cheaper, and it normally costs $1 to $2 per day, with bottles starting at usually around the 190 mark. However, those bottles last a lot longer. They usually last 2 to 3 months for our patients. Now, drug testing and using medicinal cannabis. CBD oil does not show up in a drug test. So if you get drug tested at work and you're on CBD, it should not come up in a drug test. But if you use THC, it can certainly come up positive in a drug test. But if you're using it on prescription, ask your doctor or speak to us and we can provide you a letter of support to say that this is prescription medicine that you should be using. Well, we're running out of time for today's episode. So I hope this has covered a lot of your questions that you might have been thinking about using CBD oil or medicinal cannabis in New Zealand. If you have any questions, please reach out, leave a comment, email us, and ask me the questions, and I'll be more than happy to respond, and we'll also include it in the next podcast that we do. Thank you for listening, and all the best, and I look forward to hearing from you. This is Dr Waseem Alzaher from the Cannabis Clinic in New Zealand, and you can contact us by calling 0800 CBD Oil or 0800 223 800 223 645.